Good morning. I am going to present today data from the IDMPS study. This study is a multinational, observational, real-world, cross-sectional study that includes 24 developing countries from Africa, Middle East, Eurasia, and South Asia. And in these countries, we have collected data from people with type 1 or type 2 diabetes in a standardized form that collects data from the clinical point of view, metabolic, and also from the therapeutic point of view. And in these conditions, you can see that we have 2,000 patients. And as you can see here, there is an age average of 34 years. Most of them are young people below 40 years, 74%, and just a tiny proportion of people above 65 years of age. More or less 50 and 50% of female and male, and the duration of the disease is 13 years. And body mass index in this type 1 people with diabetes have just within the normal range. Now, what happens with the different type of insulin treatment? As you can see here, most of them, 67%, receive a combination of basal insulin plus prandial insulin corrections according to the blood glucose. 3% receive just only basal insulin, and just 19% use a combination of premixed insulin alone. Now, how they inject insulin? You can see them more than 50% use disposable pen, 20.5% reusable pen, and just a little proportion, 3.1, use insulin pumps. Now, the doses. Average is about 0.4 units per kilo per day. Most of them receive a little larger. Basal plus insulin is 0.82, and 0.44 those that are using only basal insulin alone. Now, what kind of control do they use for this? You can see that 89% of the patients have already a glucose meter. That means that they have accessibility to these devices to control the blood glucose levels. 53% use this daily. I mean, every day they control the blood glucose levels, but 2.5% never did it, and 6.8% seldomly. That means that in spite that they have the devices, they don't use regularly. What about the analogs? Well, when you use basal insulin alone, almost 80% are using analogs, but just the opposite. If they are using premix, most of them use human insulin. Achievement of glycemic targets. Now, if we consider less than 7% glycated hemoglobin, you can see that almost 22% average are on target, means that attain this level of less than 7% glycated hemoglobin. And in this case, the largest percent of people attaining this level of glycated hemoglobin are those that are receiving the combination of basal plus prandial insulin. Now, when the physician states that the patient do not have to have exactly less than 7%, and according to the personality, the characteristic of the patient, and so on, they fix another story, you have seen that from 22 you rise up to 28%. And in these conditions, basal insulin and both premix are more or less the same condition, and means about 41 or 40%. Now, 50% of these patients suffer some type of hypoglycemia, and 20% of these events are real severe hypoglycemia. That means under these conditions, we can say that if we want to improve this situation, we need, of course, easy access to insulin and analogs, of course, and of course they also need devices. But above all, to optimize the usage of these resources, you have to use education. Education at every level. That means education of the physician, the healthcare team members, and of course people with diabetes to have their active and effective participation in control and treatment of the disease. Under these conditions, we are sure that we can optimize the uses of resources, we can prevent development of chronic complications, we can prevent also hypoglycemic events, and decrease cost of care, and above all, we can improve the quality of life of people with the disease. Thank you very much for your attention.